Good evening, everyone. Can everyone hear me?
Can hear you.
All right. Looks like we have a performance. So we can get started. Okay. Good evening, everyone. I'd like to call this City of Hartford Health and Human Services Committee virtual meeting to order for today, February 3rd, 2026. We are joined by Councilwoman Marilyn Rossetti, who's a voting member, Councilman I'm sorry, Josh Gill. Sorry, Josh.
No worries.
Josh Mitchell, who is a non-voting member, our Director of Health and Human Services, Benny Jackson Shahid, in our Corporation Counsel's Office, Representative Attorney Demar Osborne. My name is TJ Clark. I'm the City Council President and Chair for the committee. And thank you for joining us. We are broadcasting live on HPA-TV.org, channel 96 on Comcast Xfinity, channel 63032 for Frontier Communications. We have two items on our agenda for tonight. One, it is a presentation by Director Jackson Shahid, and then the other is item 2.2 on our agenda, Councilman Josh Mitchell with an ordinance amending Chapter 18, Article 10, Section 18-110 of the Municipal Code of Hartford to promote adequate relocation services to displaced tenants. We're going to go in order and we're going to have our update by our Director of HHS.
Thank you. Good evening, everyone. I'm sorry if I don't sound as projected. I have not been feeling well, so been fighting a little bit of a cold. So tonight's presentation is going to be focused on Senior Services Division at HHS. And so we have our runner's rebate. Basically, we have drafted a comprehensive new training manual. We have updated all program literature, established and maintained relationships with community partners, and we have processed over 5,100 applications. 97% were paid out with a total payout of almost $3 million. And in terms of our home health program, the home health program in our senior services division is a program for seniors that need assistance with things around the house, such as laundry, preparing meals, making sure that people are, following any information or restrictions from their providers, as well as just, assisting with any connectivity to resources. And so we successfully transitioned to a new vendor. Our previous vendor was Hartford Healthcare, and now our new vendor is Harriet Home Help. We established a successful communication strategy, including weekly check ins, and developed a collaborative approach to provide solutions for difficult clients. In terms of our elderly nutrition program, we onboarded new certified dietitian to create menus at the two senior centers that follow national nutritional guidelines for seniors. The dietitian is working well in a collaborative relationship with the kitchen staff at the senior centers. We reworked the relationship with the nutrition educator to keep her services despite losing the funding. So some of our operational challenges, so those are like issues and opportunities for improvement. At this particular moment, we do need two more interviewers, preferably some interviewers who speak Spanish. We need a dedicated renter's rebate van to fit the equipment and interviewers. Right now, our senior services team, um, when they are going site to site for renter's rebate, they're basically using one of our fleet vehicles, which I don't know if people have visited the health department, but our fleet vehicles are pretty small. They're either the Ford Focuses or the Priuses. And for this program, individuals are transporting printers and, lots of like files, So we are literally taking like the office to, the community, right? To make it easier for community members to apply, for the program. But to carry all of that luggage is a lot in a tiny vehicle, as well as people. And I don't know if any of you who have met our program manager for Renters Rebate, um, but she's a very tiny woman and she is really doing a lot of the lifting. So I think if she had a larger vehicle, it would make things easier for her. And also, they could travel together. So that's something that we would like to work on. Additional information that we wanted to share. The transition, to the North End Senior Center has been working out well. It's more spacious, and the members have been extremely welcoming. We have new membership applications that are actually on hold right now until some seating spaces open up in April or May. But we are um, basically we're growing, and I think that speaks to the programming that is happening at the senior center, and also the fact that people enjoy attending. So that is our update for this evening. Thank you.
Thank you very much. Are any questions?
Can I just make a comment?
Yes, Councilwoman.
First of all, thank you, Director, for coming on. Not feeling well. I'm really excited to hear that we have a waiting list. I mean, it's a good and a bad thing, if you know what I'm saying. So.
Councilman Gill?
Yeah, thank you. And I apologize. I missed the beginning of the director's presentation. But I know that we have on the agenda the relocation assistance ordinance and the changes to it. And I also know that we had a public hearing back on January 20th, at which, by my count, 21 people showed up to discuss the relocation, this ordinance change in the process. And one of the things that came out during that public hearing seemed to be a tremendous amount of criticism of the way in which the city administers the way the city was currently administering our relocation assistance program. I don't know if the director had an opportunity to review the comments made at the public hearing or has otherwise been advised of them. But I do think it would probably be important for us to have the administration's response to what we heard at that public hearing in order for us to move forward with consideration of some of the changes that are before us. So I'm just wondering what the director's position might be on that.
Councilman, we haven't discussed the ordinance yet. She's just providing her update. We didn't get to 2.2 yet.
But she'll stick around, right?
We may get her
Yeah,
response.
she's going to stick around. Yes.
Okay, good. Thank
Okay.
you. Thank you.
Any questions relative to the director's update?
I do.
Okay. Thank you, Councilman. Madam Director, do you have a number to the regular flow of attendance for not just for the North End Senior Center, but also to the other senior centers? Have you seen an uptick in attendance?
I think there has been an uptick in attendance. I can get the exact numbers for you and send it over.
Okay, that'll be great. All right, if there's no other questions relative to the director's comments, We will now move forward with item 2.2. Councilman Josh Minchin, an ordinance amending Chapter 18, Article 9. I'm sorry, I said Article 10 previously. Article 9, Section 18-110 of the Municipal Code of Hartford to promote adequate relocation services to displaced tenants. We do have the author of the ordinance on here, and I will now open up the floor for Councilman Mitchum to discuss his proposed amendment to the ordinance.
Thank you, Council President. So I'll try to sort of summarize because there's a lot of text here. What this in broad strokes, what this does is take a lot of stuff that I looked to East Hartford, which just redid their not their ordinance, but their guidelines around relocation. And they sort of did this comprehensive update that really made more clear stuff that a lot of cities, ourselves included, have been doing, but without formal guidelines or without updated formal guidelines. And my thought was this: we should have some benchmarks, some things we absolutely will do to when we have tenants who need relocation and that we're required to provide it to under state law, and spell them out, partly so the tenants know what to expect, partly so that we have a sort of a better procedure so that we don't depend on who's in charge. And that's no shade to Dr. Jackson Shaheed. That's to say, like, over time, we're going to have turnover, right? We'll have new directors, we'll have new employees. What we want is a roadmap, some basic things that we know we have to do for people who are displaced. And then the last part that I think is important is this. My goal here is to put landlords on notice about exactly what they will be responsible for under the State Relocation Assistance Act. And then to require them under our rental licensing program to acknowledge ahead of time when they sign off on their rental license, as they must every so often, to acknowledge that obligation so that later it's harder for them to litigate and say, no, I don't have to pay for this or that or the third, right? Because the challenge we have is the state says you must do certain things for your tenants. This is one challenge we have. And we do those things. And then when it's time to make the landlords pay, as the state law also says they must, they take us to court. And so it's a fight. And so part of this is to put them on notice in a way that makes it so that if they want to rent here, if they want that rental license, they have to acknowledge that obligation. And it's all laid out what they have to acknowledge. Most of this, I will say, it's stuff we've already been doing. There's some changes, and I'm going to suggest to you, members of this committee, that based on my conversations with the mayor and with some of you, some changes that I would like you to weigh in on, right? I would love to know what you think and that you might approve of. But the URAA, that's the state law that says we have to relocate tenants, doesn't give guidelines. It doesn't say how many months do you have to put them up for. It says some basic things, but it doesn't say the details. Our practice has been 3 months in a hotel. I have written this to be 4 months because the Supreme Court of our state has said that is acceptable under the law. I've gotten some pushback on that, and I'm going to get to that. But other than that change, and also what I've written in here based on what happened at Wethersfield Avenue, that we've all heard from those folks, I've added that it should be the responsibility of the landlord or the city, if the landlord won't do it, to secure buildings where residents still have belongings inside the building that they can't get at, which is what happened at Wethersfield Ave. The building was not secured. Someone broke in and stole a whole bunch of stuff from everybody. But that's really the goal here, is to create guidelines that will help the city follow more strictly the rules, to help displaced tenants, put landlords on notice, and help to recoup the money that we spend from those landlords down the line. So that's the purpose. That's the dream. I'll tell you, I talked to the mayor, and his concern was that going up from 3 months to 4 months of hotel stay is a cost. And he's right. It's an upfront cost, and of course, it's hard to recoup it. So it's money out of our budget. And his other concern was that providing security, if a landlord refuses to provide security until tenants can get their belongings out, is a new cost. And so I would propose to you, we can get to this, and maybe you will have questions, but I would say if we could amend this just down to the 3 months of hotel stay, which is what we're already doing. So wouldn't then add any costs to what we're doing. And I think as to the question of providing security, what it says now is the owner of the housing shall immediately secure the property to ensure the tenant's belongings are safe from theft or destruction. If the owner fails to secure the property, the city shall secure the property. And what I would add there to remove costs is to say, shall provide in-person security provided by Hartford Police Department within available resources. In other words, if there is an available patrol person to be posted there on a given night shift or whatever, then the city will do it. And if not, the city won't do it because we don't have the resources. So I just say that's a response to some criticism I got from the mayor. And I also want to note, Councilman Clark had expressed particular concern about making sure that the hotels where people are put up are sanitary, right? They're not what we've seen in the past, full of mold, unsafe. And my thought as to that was to add in section C, where it says, such emergency temporary housing shall include a private bathroom, and then I would add, and shall be safe, clean, and sanitary. And that gives, I think, tenants a little bit of recourse to make sure that where they're staying is adequate. But that's the vision. That's the dream. I don't want to talk and talk and talk at you. I would hope that folks have questions, or Director Jackson Shahid has questions or thoughts. I'll just add, it does provide some stricter procedures for when people are displaced, how the fire department or code enforcement connects with Health and Human Services to make sure that the tenants quickly get what they need. But I don't think that adds a cost. That just kind of lays out a procedure. But I would really just be open to any thoughts or questions that anybody has.
Councilwoman Rossetti?
Yep, thank you.
Thank you, Councilman. Okay.
And thank you, Councilman Gale. Gale, why did you started this? Councilman Mitchum.
I'm sorry.
I'm trying to find my reference now. Is this E3C? I know I had mentioned to you, Councilman Mitchum, about the security deposits. EC3, is that the security deposit?
Hold on, I'm finding
first and last month's security deposit, 4,000. So my question about that, certainly, if that's consistent with what others, but where in here are we working to get existing security deposits back? I mean, I heard that, and you and I, or you had texted me, I forget, and said we could address it with this. My concern is that if people are displaced, they're not going to get their security deposits back.
That has been a struggle. That is correct. Again, because it's money that's in the landlord's hands. And so, I mean, here's the thing, like, we could add a provision in here that says the landlord is obliged to return the security deposit.
If we're adding other things to show them that we're serious and hold them accountable, not to cut you off, I would think that would be one of the things that we would absolutely want to add.
I'm not against it. I think we could add it.
Again, I know how enforceable it is, but I just,
No, I'm sold. I mean, I think the thing is like a secure, I guess you know what we could do, because my idea here, and tell me what you think about this. My idea was because we're laying out specifically the obligations to landlords, then we can take our rental licensing statute and say, as I said, you can't renew your license if you haven't met these requirements. So if we add security deposit language here, then that can also be something that if the landlords don't do it in this case, if they don't return the security deposit, they would potentially not be able to renew their rental license. So I can definitely, that's an easy thing. And we did text about it, and it was a thing that I forgot to write up an amendment to my amendments, but it's an easy fix.
and may I, Council President Clark, and not that I don't have some of the mayor's, concerns also, but these are the concerns that I have, understanding I have some of those. So at the beginning in AC, obligations to displaced tenants, why do we add the first red, the city shall provide to the displaced tenants and the owner? Why are we then taking on what is the owner's responsibility? Or am I reading it incorrectly? Am I reading that correctly?
It's a long legally sentence, but it says the city shall provide to the displaced tenant, and the owner of such dwelling unit, living unit, or rooming unit shall be liable for and shall be liable to the
Okay,
city for.
so
Right. So the
we're
city
just
pays up
adding,
front, the
all right,
owner pays back.
all right.
Because I think
And
what we know is that the owner's not going to come out of pocket.
so we're
straight.
adding that because it didn't work before written this way?
Before it was because the state law requires that the owner pay all these URAA. That's the state law, the URAA. The state law requires that the owner ultimately pay them back. So our ordinance didn't say it as explicitly, but it was still required by state law. So what I wanted to do was make it clearer how it'll work. We pay it up front to make sure it gets paid because we know
Okay,
how some of these landlords move. It doesn't change the obligation. It just
all
sort of
right,
says,
okay.
you follow me?
I guess I was reading it that we took on the obligation, but now I understand.
So
Um,
they're still liable to us.
okay. And then my last thing, and then I'll stop. I had some other stuff, and a lot of it I certainly agree with. Only my concern, because I'm in the business of finding tenants, finding housing for people, is that we have a difficulty as it is, even when people aren't displaced. So I think there's I just have some concern around that, but that's not really a part of this. So that's all I have, Council President. Thank you.
Thank you, Councilwoman. Um, Councilman Mitchell, how how are we going to be recouping the costs from the landlords? What's the mechanism to hold them accountable if the city's going to pay the costs up front?
So up to now, the way it's happened is that I think initially, and maybe actually Attorney Osborne will be able to give a little more practical detail, but I think initially we just sort of say, hey, you owe this. And if they don't pay it, then we put a lien on the property. And then we may not recoup that until the property sells. So my vision here is that if we create these strict rules, right? So we put them on notice. You are responsible for this, this, and this. And then in our rental licensing statute, we say, if you owe money under Chapter 18, Article 9, this section, if you owe money under this section that's unpaid for X amount of time and you haven't made a payment plan, you can't get a rental license again, right? So we've put a little more of a hammer because a lot of them are happy to just let that lien sit on the property. They'll keep renting it out and they worry about it when they sell it, which practically just makes it harder to make these properties sell and to get better landlords in. So this would actually make it so they can't even, after a little while, whenever their rental license would renew, they can't renew if they have an outstanding bill based on relocation. So it's the same as before. the recouping the money, but with a little added hammer.
Okay. So regarding this, before I go further, I wanted just to circle back to the residents that came before the public hearing to express their dissatisfaction regarding HHS staff. I uh, just wanted to talk this through with the director to understand in the event that this ordinance is passed, how is the HHS department going to be able to handle the influx of claims, not claims, but inquiries regarding relocation assistance from tenants? Because there's been complaints before regarding from the Sherbrooke Avenue building where HHS staff just was not providing adequate service. There was not timely responses to the tenants. And so I just wanted to see our lessons learned from that incident. Would HHS be prepared moving forward for more timely responses and also to assistance?
Sure, I can talk a little bit about moving forward as well as Sherbrooke. But what I will say, with the relocation program, it is a very unique program, as opposed to some of HHS's, programs such as WIC or MyOp, where the entire program is under our purview. The relocation program, as it stands right now, is across multiple departments in the city of Hartford. And so it's very difficult to just pinpoint exactly where some of the frustration comes from when it comes to our residents. I think part of the issue is, or not just issue, but where I could see residents becoming frustrated is because number one, um, they've just lost a lot of things, right? Their apartments, their dwellings, possibly clothes, documents, memories. So this program is not just, and we do have a process of how we do our intakes, but this is it's a very social service heavy program because every incident and every case and every situation is different in terms of resources. So how we engage with the residents are different based on their individual situation. Obviously, the intake process is the same, but how we get to the end result of what they actually need is very different. I do think that we have improved the overall relocation process by including the tenant liaison who is doing more check-ins with the residents now, whereas that wasn't a part of the relocation process before. In terms of the intake, we intake the individual, the resident, we gather all the information, we give them the packet, we let them know about how the process works, and then we kind of are just waiting for them to give us either documents that we're requesting or the lease from their new apartment. We will check in with them, but I don't think it's as much as someone who just lost their a lot of their belongings really needs in that situation. And I think people feel, and we're not discounting how they feel, but in that moment there's a lot of needs. And in the relocation program itself, that program or that process, doesn't really include the case management piece because we don't have that capacity. So we have social workers that can deal with residents during their specific time of need when they come in and they're getting acclimated into the program and what this program is. But in terms of following them, contacting them, and maybe they need that case management. We don't have the capacity to do that. So what I will say is the tenant liaison, doing more check-ins with them, I think that will ease a lot of people's minds. It will actually, assist them with further connecting to resources. And if they, are communicating back and forth with property management, the tenant liaison is there to assist them with that. I think moving forward, if there is an increase, which we have, I mean, we're always busy in relocation because there's always fires or some sort of emergency. I will say that on the HHS side, we may need additional staff because right now we are working with Arlene as a senior project manager. And she's also over our HUD and lead program. And then we have Miss Brenda, who is a social worker that is full time, and Miss Wanzola, who is part time staff. She is not a full time staff. So we are working with 1.5 individuals for the relocation program. And they are amazing because they're on, even if something goes down at 2, 3 a.m., they are there. But we are working with limited staff. So if we're really looking to flesh this out and improve on the process and, really spending that extra time in terms of case management that people are in need of, we definitely are going to need, to look at this as more of a social service program and really have some social workers on staff full time. Because right now I only have one, and Miss Wanzola does an amazing job at part time, but we really need another full time staff.
All right, thank you for that. As we are preparing for the 26 and 27 budget year, is another full-time social worker a part of your budget?
I don't know. I don't remember exactly what we put in all of our our cases because we did put in quite a few positions. But we will definitely make sure that um, that was in there. And I believe it is, but I don't want to say for sure. With all the cases that we did put in.
Yeah, Councilman Clark, if I could just
Yes, sir.
add something, and I want to say, like, I definitely appreciate very much what Director Jackson Shaheen said. This is, already the ask of HHS is a lot. I one of my hopes in when in getting the tenant liaison position created is that was going to be a person who could sort of take like a larger view of this process and be able to say, okay, what we need is another social worker or whatever. And I tried not to add into this amendment to the ordinance too much in the way of like nitpicky detail. I mean, one thing that has come up that came up at Sherbrooke and came up with Wethersfield Ave is that it was the city's process to make the displaced tenants get a document from code enforcement and then personally bring it to HHS at their office. Like that's where their meetings take place. I think it would be a lot better if HHS could go to them, which they do when they can. I didn't put that in here, like that HHS has to go to them to have all the meetings. Because I know that HHS wants to do that and will do that if they have the resources. I did try to put something that streamlines the document process from fire department to code enforcement to HHS. So I did try to take a light hand here so that there's no obligations that we can't meet with the budget we have, for what it's worth. But I mean, I agree. The dream would be to have a more robust staff to be able to do what folks want to do, more and better.
No, that's totally understandable, Councilman. Madam Director, do you does your team go on site to the motels to do intake? How does that process work?
We actually get the list from LNI once the vacate letters are given out, and then we make appointments with residents, and residents come into our office. If there is a resident that doesn't have transportation or something like that, we have gone out to where the resident is, wherever they may be, and do the intake. So we have done that. But we do, go by appointment because, we are busy. We have a lot of people coming in. And sometimes, people just do walk in, if we can't get in contact with someone or we're leaving messages, and we're not sure, if they're going to stay in one of our hotels, or sometimes people go with family and then change their mind. They may just do a walk in. But we do go on site. And my team also is on site when fires actually happen. So many times, Arlene is at the safety complex with the rest of the team, with the rest of the emergency team, and walking through the process and helping people, get connected with American Red Cross and such. So, yes, we are on site.
Councilman Gill, you have any questions,
thank you.
concerns?
Yeah, sure. Thank you, Mr. Chair. I'd like to ask the director a couple of questions, then I have a couple of questions for Councilman Michtam or observations. Director, do you have in mind, you mentioned that this relocation is sort of an ongoing process. I think you said there's always something going on. I'm just wondering if you have any statistics over the last, that you could provide to us as to the actual numbers of people that we've served through this relocation business over, the last 12 months, the last 2 years, last 5 years. Do we have any of that data available?
We can get that data for you and put it inside of a report. Yes.
Do you have any, just a gut, are we talking about 100 families a year? Are we talking about less, more? And can you give us a range at all?
Well, this year alone, and I'm not talking about starting in January, but this past year, we served more than 100 families. And if we're talking about dollars, just with Sherbrooke alone, we spent over $600,000 for our portion of the relocation program. And that's including the hoteling costs. And then we also give out, the security deposit, and whatever's left over, can carry over into paying for the person's first month's rent. So, it's up to $4,000. If an individual, gets a really good apartment with a security deposit, maybe 2,500, 3,000, then whatever's left over can go towards their new apartment. So that's why I said it's really depends on, the case,
No,
the fire.
I certainly appreciate that. That's why I was asking whether we just had sort of data over a long period of time, so we could just sort of get more of an average sense. I appreciate that, individual cases are going to be different. Just wondering if on on a 5-year basis, are we looking at 100 families every year on a 5-year average? And if you don't know, you don't have the data now, that's fine. I think it might be interesting and important for us to have it if you can put a report together.
Sure, I could definitely put a report together for you. But I would say that we are probably, in terms of Hartford, we are very similar to other large municipalities like Bridgeport, New Haven. In terms of numbers, we're similar with their numbers, but I can give you the exact
Yeah,
number.
well, I don't know what their numbers are, so that's, I mean, I'm sure you're right, but I don't know what their numbers are either.
Yeah,
yeah, if you can get them, that'd be great.
sure.
And I'm glad to hear that we're just comparable to everybody and not worse. It would be great if we were better. Second question for you: have you had the opportunity to go through this proposed ordinance change and really try to figure out how much actual staffing? I mean, I know you said you would need one more social worker, but I'm wondering, is that, have you looked at the requirements of the ordinance to say, yeah, that'll do it? And among other things, we haven't talked about, for instance, at the last part of the ordinance is a reporting requirement. You may be doing some of this already, but you may not. And I don't know what's involved in putting these reports together in terms of employee hours. And I don't know how, as a director, you go through and you say, oh, well, this is 10 employee hours and this is 2 months, but I'm just wondering, have you had the opportunity to do that with respect to administering the changes that would be made by this ordinance?
So just like any other ordinance, and I'm still getting through it, obviously it really depends on, the support that we get for, the staffing that we may need to be able to meet the deliverables of the ordinance. I think, a lot of times we just work with what we have. Obviously we advocate for what we need to get things done. But like Councilman Mictum said, it may be in the ideal world, right? It's going to be, it would be a more fleshed out department in terms of staffing. But definitely whatever the ordinance, states in terms of what's required, we would try to make sure, that we're meeting deliverables. But like I stated previously, as it is right now, if there is going to be more requirements from the HHS side, yes, we did get the tenant liaison to do a lot of the mediation between the resident and the landlord, but there is still a programmatic side when it comes to us, where we are doing a lot of the paperwork and checking in with clients, and not just going through the paperwork, but actually doing the connectivity to services pieces, in terms of resources, and literally case management with individuals. So, that is something that, when you ask for an actual report or numbers, we can actually, include in that report what would be ideal for us, in terms of staffing, if that's something that you would like us to look at. And we'll
I think that would be helpful for everyone. I mean, if the Cadillac version requires us to hire 10 new employees, I think we might say, well, we may not be able to make the Cadillac version. So let's see if there's a economy model that can, do the job and hopefully improve on how we've been doing the job. So
Hyundai's
yeah,
a good car,
great.
Councilman. Don't
Pardon
sleep
me?
on the Hyundai version. Don't sleep on the Hyundai version.
I
Perfectly
drive a
adequate
Hyundai. I'm really good with Hyundais. So, so yes, thank you, Director. That would be great. If I may, Mr. Chair, I'd like to ask Councilman Mictum a couple of questions.
Yes, you may.
So I put my lawyer hat on when I look at this thing, so I have like lots of little tweaks, and I don't know that we need to discuss those right here. I think it would be perhaps helpful if you and I get together and we can talk it through, and you can decide whether some of these things make sense or don't make sense. It's interesting to me. I know that our public hearing, a lot of people came out and they were responding to a particularly bad landlord. One of the problems that I have, and one of the problems that I want to end up addressing with you, is that not all landlords are bad. And not only are not all landlords bad, but not all relocation issues are caused by the landlord. I think, this ordinance is very well-meaning. I'm very supportive of most of the changes, but it does have a bias that implies that the landlords are always at fault. And I don't think that's accurate. And I think we're going to need, we need to address that to some degree. with some of the language here. I note that on the state statute, it's very clearly set out that it's an affirmative defense for any landlord that the cause of the relocation was not a violation of housing codes. And I take that to mean that, and this is what I've seen in my own practice, there are times when a fire is caused by a tenant. And that's not that's not relocation. It's caused because the landlord failed to comply with section 47A-7, which is what the state statute says. So just sort of putting that out there, I went through and saw, areas where we could just make reference to these things. And it's also interesting that the city, and I was part of the crowd that the city's relocation ordinance did not come into existence until we passed the landlord licensing. They were in the same ordinance as I look back. So apparently we just relied on the state law up until 2019 when we passed the whole rental licensing ordinance. This section 18110 was then added at that time. And so, good for us at that time, good for us for, looking at it a second time. And, but I think we've learned a little and we're going to have to, we'll adapt accordingly. So, I don't have any specific comments, Mr. Chair, with Councilman Mictum. I do have lots of comments, but I think they'd be better offline. I see him shaking his head that he agrees with that, and I would appreciate the opportunity to do that and report back at the next meeting with where we are on it.
Yeah, no, most definitely, because I mean, I appreciate Councilman Mitchum's attempt to amend the policy. I think it's something that it is been overdue, and then we want to do this right to make sure that our residents who unfortunately would be displaced feel protected, that we protect the interests of the city as well, to make sure that we're not going over budget, but also and making sure that we're holding these landlords that are not doing right by the displaced tenants held accountable too. Another thing that I think that we should be discussing is the fact regarding, and Madam Director, I see your hand, is regarding the types of motels that the residents are being relocated to. That is something that I personally have been talking about since I've been on council. And we can no longer participate in this practice of just sending them to a Super 8 or sending them to the Econo Lodge in East Hartford. We have to have some meaningful conversations, and also to recognize that we have a budget, but there has to be some type of way where we can relocate these displaced residents in some areas that are more family oriented, especially reasonable accommodations that is needed for tenants regarding residents that have disabilities, and also to areas where there's kitchens, because little children have to eat. People who have that have medication that needs to be refrigerated, they need to make sure that they are very well protected as well. So these are the additional things that we should be having some conversations on amongst the other amendments, suggested amendments that we were discussing, so that we can be able to report back for next month's meeting and hopefully have some agreement. Madam Director, did you have something additional you wanted to say?
Yes, actually, it was on what you were just mentioning about the hoteling piece. Just looking through the amended proposal, I wanted to say perhaps there should be some sort of criteria added, because I think the verbiage of just kind of safe and these words, it's very subjective to an individual for, either what they're used to or what they're expecting. So perhaps have a criteria for, housing or hoteling. Perhaps, and I don't want to say anything specifically, but, you could, associate either a specific type of stars to it, or, a certain square footage, or something that's, that we can actually measure. And that way our team, because a lot of the hoteling, if we do get complaints on, okay, an area is specifically not safe, those things have been brought to our attention before. Again, multi-departmental, HPD has to get involved if there's a safety complaint. If there's mold in a hotel, it may or may not be in Hartford. That's something that we also might want to look at, because right now we hotel individuals around hotels that where there's availability, and all that availability sometimes is not just in Hartford, it's in other towns. So we have to then get environmental or buildings from another town to actually do the inspections. So things can be lengthy. So perhaps if there's a criteria already set, we actually know specifically, where people would be housed. And then also think about possibly, having spaces that, I don't want to say that the city owns, but spaces where we have already secured for relocation or temporary relocation. Thank you.
Councilman?
Thanks. I want to address what the director just said, but I also would sort of want to come back to a couple things Councilman Gill said just quickly, because I know we're going to keep working on this and I don't want to draw it out. But I just will say first, as to Councilman Gill's question to Director Jackson Shahid about, what obligations in terms of staffing or, staff hours this puts on her department. My intention here was mostly to simply put in writing sort of the best version of what we already do. So the goal was mostly, with the few exceptions I discussed earlier, was mostly not to try to add a lot more obligations. But again, I think we can all revisit that with more time and study. And then to Councilman Gill's comment about sort of the landlords who are and aren't at fault, I just want to say my intention was to not add anything that the state statute doesn't require. I maybe have been imprecise in the writing, so that's something us boring lawyers can talk boring lawyer talk about. But just to say that was really the goal. And then lastly, as to the director's comments just now, it's tricky to come up with criteria in writing that will get us to where we want to go as to the quality of the hotel. The best I sort of could come up with was shall be safe, clean, and sanitary, which still leaves a lot of discretion for, I suppose, the director. But it's a thing I think that I would love to discuss with her and sort of think creatively about what can we put in here that's concrete. And with you, Councilman Clark, because you had brought the issue up to me as well. All of which is to say, I would ask some member of this committee to move that we just postpone it so we can do more work on it and take it up again next month.
I make a motion to postpone agenda item, is it 2.2? I'm sorry. Agenda item 2.2.
Yeah,
Much,
second that motion.
Motion is postponed, been moved to postpone. Is there a second? Any discussions on this matter? Hearing a seat. No problem, Councilman. You're welcome. We'll work on some resolutions. Since we have no discussions, all in favor of this postponement indicate by saying aye.
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 Aye. All right. The ayes have it. This item is postponed until next month's committee meeting, where we will have a report out. Since we have no other business to discuss in this committee meeting, this committee meeting is now adjourned. Thank you very much for joining. Wish everyone a good night. Stay safe and stay warm.
Good night.
Yes,
night.
likewise.
Thanks. Good night, Tom.